Hi everyone, happy Tuesday. It is 8 o'clock and we are ready for Lipstick and Lipo. I'm just waiting for Ashley Amalfi to join us and we will get started. You've got 15 minutes. We are talking about a topic that has come up time and time again. People have been asking about fat transfer and fat grafting, and tonight is your night. We are going to talk about it and answer all of your questions. So if you have any questions, make sure you we will answer them. Hi guys, thanks for joining. Ashley just entered, so let her in. Hi,
Hi, girl.
how are you?
I'm great. How are you?
I am good. I'm good.
I'm
Um,
excited. This is a good topic.
this is a great topic. I feel like every single week people ask about it. So we're finally going to talk about fat transfer.
Awesome. Come with
Awesome. So
questions.
yes. All right. I'm going to get the clock started. 15 minutes.
Love it.
All right. We are on.
Awesome.
Perfect. So this has come up time and time again. We both do it in our practice for different reasons. I think the good thing about fat transfer, so essentially it's, we perform liposuction, usually limited liposuction in a certain area, harvest the fat, we process it, and then we inject it back into different areas depending on what we're there for.
Right.
So
It,
do you
yeah.
have any? Yeah.
It has to be your own fat too. I mean, that's a question that comes up
Oh
time and
gosh.
time again.
Oh,
It's like
it's like a running joke. I think
yeah, it's
everyone just wants to donate fat.
everyone wants to donate fat. Just like any other, transplant, you have to have your own fat because your body has to take it just like a graft, just like any other graft. So we're taking fat out of one area and moving it to an area where you'd rather have it. It's kind of like what people would joke with us about constantly, right? Until it actually became a technique.
Right.
So people would say,
Exactly.
"Oh, when you can suck fat out of here and put it in my chest, then I'm going to sign up." And it's kind of like, well, that's the reality now. So how
Exactly.
cool is that?
Well, and it's interesting too, because traditionally it was used primarily for reconstructive
Right.
purposes. We use it a lot in breast reconstruction, in different, traumatic injuries that people had where they had like deep scars or contour abnormalities. And now it's really expanded to the aesthetic
Yeah.
arena,
Did
which is
how did
really
you
nice.
how did you get into it? Did you first start with recon as well with breast reconstruction?
Yeah, I mean, that was
Yeah.
pretty much the only time we did it during residency, was with reconstruction. We would
Right.
always do it with our secondary reconstruction procedures, or, if patients had like fat loss and, those craniofacial kind of deformities, we would do it for that. And we were just beginning to, start doing BBLs towards the end of residency.
Were
It
you?
was like it
Yeah.
was like just starting to become a thing.
A thing. Yeah.
Um, yeah,
Yeah.
and of course Del Vecchio and all these guys have been doing it for years and years and years. But
It became popular.
it
Also,
became really popular
trends
recently.
really change too. And as plastic surgeons, we're constantly kind of pivoting and adapting to like what's cool. And you can actually see the mosquitoes on the camera.
I don't know how
And
you do it. I would be going nuts right now.
I'm covered in bug spray. But it's just so nice to be outside. But yeah, I mean, so changing trends. And then I think we got good at it with reconstruction. I mean, I do fat grafting on all of my breast reconstruction. And
Right.
I think it's this really cool adjuvant technique that we have to like mold and shape and sculpt a breast.
Mm-hmm.
And so I think we learned a lot. We studied it. We had good long-term data to show that it was safe.
Right.
It wasn't going to cause cancer, and that those stem
Right.
cells actually helped the skin quality and helped the quality of scars. And so I think
Yeah.
then once we all got really comfortable doing it with reconstruction, we ventured into doing it more for cosmetic reasons.
Absolutely. Right. And like you said, it does great things with the skin quality, so with radiated skin or really just
Yes.
traumatized skin, it softens it, which is
Yeah.
really nice.
I
Um,
agree. I agree. I think it's a really great adjunct when you have a scar that you don't like, or mostly a scar that's kind of depressed, that you
hmm
can really, just like any other filler that we've been talking about in these last few weeks, that just kind of plumps it up and
Right.
brings everything back up to an even level. So for small defects, that is
That is
a
great.
really awesome option.
Um, So it's come up quite a bit. People want to know more about fat grafting for breast augmentation. I
Let's
feel
talk
like
about
I
it.
get, so before, I mean, we kind of talked about this as well. I think the past year or so, I've been getting more patients that weren't really interested in implants and wanted more of the natural augmentation or the boost. And at the time, there were a lot of things going around in the public with implants and textured implants and things. I think people were just scared,
Yeah.
which, we know implants are safe. But there has been that trend towards more fat transfer. And I know you've seen the same thing in your
Yeah.
practice initially, right?
Yeah, I
Yeah.
think that's exactly right. It's about picking the right patient for this, because it is not an implant, and it is not the same operation as a breast augmentation with an implant, but it is for a patient who wants just a little bit of a natural fill.
Yeah.
A lot of my patients have had kids, and they experience a lot of deflation in the upper pole of the breast. So
Mm-hmm.
after they like gain and lose weight, or if they breastfeed, the top of the breast kind of gets concave, which is a beautiful natural shape. But they want that fullness that we had when we were young, like
Right.
that more swollen upper pole. It's never going to be as round up there as an implant. It's never going to give you that big kind of bump,
Mm-hmm.
but it fills it out. And so I think if you can feel out those patients who just want, I tell them it's not going to change their cup size. It's going to just really fill them out. So,
Right.
if they're kind of barely a B and that B kind of gaps at the top with enough fat, I think you can make them a really full, kind of voluptuous B. But I think it's hard to get them to another cup size. Do you
Right.
agree?
I agree. I mean, I think if you put in if they have a lot of fat to give, and then you
Yes.
also are able to put in a good amount and a safe amount, maybe you can push it to that 1 cup
Yep.
size.
I
But
agree.
to get to like 2 cup sizes or 3 cup sizes, or to have that, even that 1 cup size reliably augmented, it's really tough with fat because, as 40 to 50% of it does dissolve. Our body absorbs it over time, usually in that first 6 months to 1 year. And so it is normal to need perhaps a second treatment, so I always tell people, listen, if you are at, like, you definitely want that 1 cup size bigger or that 2 cup size, like, you can reliably only do it with an implant.
Yep.
But if you're willing to do these other things and you understand that you're going to lose some of the fat over time, and that is okay with you, and you just want that boost, or to fill out the cup that you have, then it's an awesome option because it is
Yeah.
your own fat. It's safe. You don't have to worry about rupture or capsular
No,
contracture, all these other things that come along with implants,
you
and
don't
it doesn't
have to,
hurt.
right?
The only thing that hurts is where we take the fat from, right? Like the
Yes.
liposuction part of it. But
Yeah,
that's really it.
I think that's another huge key, is that this is so straight. It's so simple. I mean, it's actually as simple as it sounds. We just suck the fat out of somewhere else with
Hmm.
liposuction, and then we process it, and then we inject it into the breast. So there's no big incisions to heal. There's really no downtime other than you're a little bit sore, and the breast hardly hurts at all. I mean, it's these tiny little poke holes that have like one stitch, if anything at
If
all.
anything, right?
And then that just helps us fill it in with these tiny little cannulas. And then liposuction is sore, but there's really not a lot of like, oh, you can and can't do this. It's just you're a little bit sore, and so you might not be as active because it hurts, but you could go to work.
Exactly.
And I think people love the option because the recovery is so awesome.
Exactly. So we have a question about fat necrosis. So what do you tell? So fat necrosis is essentially when, when we inject the fat, we remove it from one area and put it somewhere else. It needs to regrow new blood supply, essentially, in this new area. And so depending on your technique or depending on your ability to regrow that, some of the fat cells don't get the blood supply that they need, and they either dissolve or they form, or they kind of die and form these like hard lumps,
Yeah.
underneath. So what do you tell people as far as the
I think
probability of that
I
happening?
think it's pretty low. I think that most of the time what I see is that the fat just kind of dissolves, and it will slowly
Mm-hmm.
go away, and it's smooth and soft. I tell them that they might find little areas where they can feel just a little bit of a bump, and it almost feels like Rice Krispies. I tell people, like a tiny
Mm-hmm.
little grain of rice. I think you find that more if you put a lot of fat in there. And so I tell
Right.
them that, once things are tight and full, putting and shoving more fat in there is not, it's not healthy, and the tissue is not going to be able to support those grafts. And so then the tissue is just going to die.
Right.
And so that's why we don't overdo it. And I think as we've learned more about fat grafting and kind of evolved in our technique, I think we see it less and less because we kind of get it now. How do you feel about that?
I mean, I tell them the same thing. You know, it is normal to feel those little nodules here and there, but, you know, massaging it and really helping.
Yes.
I mean, I am so, you know, if the second I feel something, I just make them really massage it every single day,
Yes.
twice a day. And it just breaks up those little areas and just allows, you know, blood to kind of get in there almost. It's like the simplest way to explain it. But I think as long as you're safe and conservative with how you inject it, the amount you're putting in, you're really increasing the surface area of those fat cells so that they,
I agree.
You know, stay healthy.
The other thing we used to worry about along the lines of fat necrosis is, you know, if it's calcified and we can feel that it's kind of hard and crunchy, what does that look like on breast imaging? And, you know, women are having mammograms. And I think at first we didn't know what that would be like until we had all this data for our reconstructive patients. And I think radiologists are really used to seeing fat grafting now. And so they know what it looks like. They know what fat necrosis from breast surgery in general looks like. And so I think women aren't having the false biopsies that we thought that they were going to have with fat grafting. There's actually studies and data to show that people have more fat necrosis from just a breast reduction than they actually do from fat grafting. And so any breast surgery is going to leave a little scar, but when you have your mammogram, you just let your doctor know, I had this breast procedure, and they'll be able to determine, you know, what is a concerning area and what is just a surgical scar or a scar from your fat.
Right, absolutely. And, you know, and I think that's the biggest question that people ask with any type of, when you're putting in implants or fat, they want to know if their risk of breast cancer is going to be higher, or if the imaging will be able to, you know, look around the implant, or, you know, be able to tell the difference. And it can. So it's very safe. All right, let's see. Micro versus macro fat. What are your thoughts?
So I use a very tiny Coleman cannula, and so my thought is micro fat. But I know that there are some people who have great results using different techniques in macro fat grafting. It's just not what I was taught, so I don't do it. But I would love to learn it and you know, see what that's like as well. But I use very small amounts with a very tiny cannula in single passes, just like we do in breast reconstruction. Just within the tissue. Is that what you do?
Yeah, typically, you know, and also depends on where I'm injecting, right? If I'm doing it in the face, then I really want small cells, right? So I'm doing nano fat and that type of thing where you're really breaking it down. But, you know, again, with all of this, it's really your technique and how much you're putting it down. You know, Coleman technique, if you're injecting it as you're withdrawing and you're laying it down in layers and overlapping it, you just increase the surface area. So those are safe techniques, and you're not putting in too much, right? That's when you start seeing problems. If you, like you said, if you're just stuffing the fat in there,
and it's hard as a rock,
you're gonna have problems, you know. And I think that's our biggest issue that we're seeing now with the BBLs, is that, you know, you have these people that are doing it that aren't trained to do it, that don't know the anatomy, and they're putting in way too much fat.
Right.
And it's one of the most dangerous in the wrong areas. And, you know, that's, you know, one of our most, it has the highest complication rate of everything that we do, the highest mortality in all of plastic surgery. It's, you know, because people are just not doing it right. So at the end of the day, it's all about technique and just being aware of the anatomy and and safety, all of that.
Safety first, as always. Yes. And, you know, we touched on it, but you had said, you know, ooh, look at that. I saw it on the camera. We were saying, you know, does it cause cancer? And there is good data now to show that no, it does not. You know, that the stem cells in fat are not dangerous in any way. They are not increasing your risk of breast cancer. And that this, amongst other breast surgeries, does not like hide a cancer. It doesn't make it harder for us to detect a cancer. And so if you're someone who has frequent imaging or family history, it's a perfectly safe procedure for you to have. It also doesn't mean that you can't have an implant. So there are some people who would maybe want fat grafting to see if it can give them the result that they want. And it doesn't really burn any bridges. So if you wanted to have an implant after that and get more fill, that's totally a
Yeah,
reasonable thing to
that's
do
fine.
together.
Exactly. Well, and that's the thing. I was just going to say too, you can combine fat grafting with these other procedures, right? Like you can put in an
Hmm.
implant and do fat grafting, especially if people start getting rippling or visibility of the implant.
Hmm.
You can do it with a breast lift. If
Yeah.
again,
And
if you
that's
want that upper
awesome.
full
Yeah.
fullness, because you're never going to have upper full fullness without an implant. You're getting eaten alive. Good thing we
I
only have
know.
41 seconds.
Uh, and
But it's a
I
great
love
adjunct.
doing it. I love doing that with a lift because with a lift, we're actually, moving around the tissue and open things up. And I can see the inside of the breast and the
Hmm.
muscle in all the places where I want to put the fat. Whereas when we're just putting it in, we're injecting it without actually seeing the anatomy. So I really like doing it with a lift because I can really see that those layers and get it in the layers that I want.
Right.
And it's a nice little boost for the lift. It just gives it a round, fuller shape that you just can't get with just their own tissue. So I think that's
Right.
a super common combination that patients are super happy with.
Yeah, exactly.
There it
All
is.
right, ladies,
We
we
did
are
it.
out of time.
That was a good one. I
That
think we
was a
can,
good one.
yeah, I think we can kind of venture out on this if we want to talk about BBLs. But I thought this was
Yeah,
great.
I think it's good. And if you guys, as usual, let us know what you guys want to talk about. I know mommy makeovers are on the list.
Yeah.
But yes, so just let us know. We will talk about it. And thank you guys all for joining.
Thank you.
We love seeing you guys every week. And
It was great to
Ashley,
see you.
love
Worth
seeing
all the
you.
mosquito bites. I love just being out here and seeing you and chatting.
Awesome. All
All right,
right, we'll talk
Lovey. Have a
soon.
great night.
Bye, guys.
Bye.